Spinal fusion is the most expensive operation in American hospitals. Billions of dollars a year, and some Americans have started traveling abroad to pay a fraction of it. But before the plane ticket, there's a quieter question the price tag never shows. First, the ground rules. This is a cost comparison, not medical advice. We are not doctors, and nothing here tells anyone to have a procedure, skip one, or book a trip. Every figure comes from publicly available data, the Agency for Healthcare Research and Quality, the Centers for Medicare and Medicaid Services, peer-reviewed medical journals, and the Kaiser Family Foundation. Where a number is only an advertised estimate, we will say so. Start with the American price. According to the Agency for Healthcare Research and Quality, spinal fusion is the single most costly operating room procedure in U.S. hospitals, about $14 billion across roughly 455,000 hospital stays in 1 year. Americans pay more for it than for almost any other operation in the country. The average hospital cost runs past $50,000 per stay, and the list price billed to someone without insurance runs higher. Reported figures range from $60,000 to well over $200,000 depending on the hospital and the case. Now the other side. Hospitals in Mexico advertise spinal fusion packages reportedly starting around $15,000 to $30,000, roughly half to a third of the American figure. Same procedure, same titanium hardware, a very different bill. Hold on to that word, reported. These are advertised marketing numbers, not independently verified, and there is no official per procedure price. So why would anyone get on a plane for back surgery? The math is part of it. In 2023, about 25 million Americans under 65 had no health insurance, per the Kaiser Family Foundation and census data. And for them, a $50,000 hospital bill is the whole bill. Even for the insured, a U.S. plan generally does not cover an elective operation in another country. So on paper, the savings are real. That is the setup. Here is the part the price comparison leaves out. We built the thing, the brochure skip, a free plain English medical travel checklist linked in the description. What to ask, what to confirm, what to bring home. And keep one question in mind because the research makes it the important one. Not where to get a spinal fusion, but what the studies say a spinal fusion actually does. Here is what the published evidence reports. For ordinary chronic low back pain, a major randomized trial, the British Medical Research Council's spine stabilization study, found that spinal fusion was no more beneficial than an intensive rehabilitation program. A peer-reviewed review put it plainly. Fusion rates climbed for years, the authors wrote, despite the absence of good evidence that it helps that kind of pain. And the operations kept rising. Per published figures, elective lumbar fusions in the U.S. went up about 62% between 2004 and 2015 and more than doubled among patients over 65. Fusion is also not a single event for everyone. One peer-reviewed cohort reported that about 1 in 5 patients needed another operation within 4 years. None of that is a verdict on any one case. Surgeons fuse spines for fractures, deformities, and instability where the evidence is much stronger. It is simply what the studies report. The cheapest version of an operation is still expensive if it was not the operation that was needed. That reframes the trip. If, in the published data, about 1 in 5 fusions is followed by another operation, the question is not only the sticker price, it is who handles a revision and where. A U.S. insurer generally will not pay for care tied to an elective operation performed abroad, and follow-up after international surgery is not assured back home. So an honest accounting includes the second bill, not just the first. The return flights, the local care, the imaging, the time. The reported savings are real. So is the possibility that more of the cost arrives later. So here is the picture, both sides on the table. The savings are real. American spinal fusion is the most expensive operation in the country. Millions of people are uninsured, and wanting to avoid a 6-figure bill is not reckless. But the risks are real too, and they are a particular kind. This is major, sometimes irreversible surgery. The published evidence for chronic back pain is genuinely debated, and in the data, roughly 1 in 5 patients face another operation. The honest move isn't a yes or a no. It is to know exactly what you are buying before you book, whether the surgery fits your case, who is accountable if it needs revision, and what a second bill might be. That is a conversation for you and a licensed doctor, not a price tag. You shouldn't have to go broke to feel whole.